most newborns require only simple supportive care after delivery. However, failure to initiate adequate breathing at birth is a common cause of stillbirth and neonatal death. The golden minute implies that all newborns should by 1 minute of age breathe on their own or should be ventilated with a bag and a mask. Assess the newborn. Start a clock or note down the time. Immediately after the delivery, dry the newborn thoroughly with a towel and assess. Remove wet towels and cover to keep it warm. If the newborn is crying and breathing well with a good color, moving its arms and legs with a good tone, and has a heart rate above 100 beats per minute, proceed with routine initial care of the newborn. If the newborn is not crying or breathing well after drying, is limp, and does not move and has a bluish or pale color, you need to proceed to neonatal resuscitation immediately. The resuscitation must be started within the first minute of life. Airway and breathing. If the baby is born with meconium, or if secretions are blocking the mouth and nose, and you need to resuscitate, first clear the airway. Suction before you start to ventilate. It's important that you suction meconium out of the newborn. Be careful not to blow meconium further inside the newborn. Stop suctioning when secretions are cleared, even if the newborn does not breathe. Suctioning too long, too vigorously, too deeply, or too often can cause injury, slow heart rate, and prevent breathing. Stimulate the newborn thoroughly by rubbing its back. Drying, clearing the airway, and stimulating breathing should take less than 1 minute. If the newborn, despite clearing the airways and thorough stimulation, is gasping or not crying or breathing well, you need to act fast and begin ventilation with a bag and mask. Follow your facility's routine for when to cut or clamp the cord. Use an area beside the mother if the cord is left intact. A skilled birth helper can clamp or tie and cut the cord if the baby is moved to a resuscitation table. Cutting the cord should not delay the start of ventilation. Begin ventilation by 1 minute. Call for help. Position the head in a sniffing position to open the airway. Use a self-inflating bag with a fitting mask. Select a mask size that fits over the newborn's nose and mouth. Size 1 for normal weight newborns. Size 0 for small newborns, less than 2.5 kilos. Place the mask over the newborn's mouth and nose. Be sure that no air is escaping from the mask. It should not be positioned over the eyes or overhang the chin, as this will make a good seal impossible. Give ventilation breaths at a rate of approximately 40 breaths per minute. If the chest is moving with each ventilation breath, continue ventilation for 1 minute or until the newborn begins to breathe. It's very important that the ventilation technique is effective. Make sure that the seal is good, that the chest rises, and allow the lungs to restitute between each inflation. If the chest is not moving immediately, reapply the mask and reposition the head. Count out loud. 1, 2, 3, 1, 2, 3, as you ventilate the newborn. Squeeze the bag as you say 1, and release the pressure on the bag as you say 2, 3. This helps you to ventilate with an even rhythm at a rate that the newborn's lungs are naturally adapted to. Keep ventilating with good chest movement until the newborn begins to breathe. Reevaluate the breathing continuously and at least every minute. Check heart rate every 3 to 5 minutes. If the newborn has not established regular breathing or the pulse is below 100, you continue ventilation. Some babies improve quickly and begin breathing well after a brief ventilation. A baby who's breathing well may be crying, or breathing quietly and regularly. A baby who is not breathing well may be gasping or breathing abnormally, or not breathing at all. Continue ventilation. If the chest does not rise during ventilation, try to reposition the head and lift the newborn's jaw forward with one hand. Try to clear the mouth and nose of secretions, reapply the mask, and squeeze the bag harder. When the newborn is breathing well and has a heart rate above 100 beats per minute, you stop ventilation and continue observation for 5 minutes. If the color is bluish, or the newborn is having difficulty breathing with indrawings or grunting, give oxygen by nasal catheter or prongs if available. See action card on safe oxygen management. If the breathing is normal, you can position the newborn skin to skin with the mother. When to stop the resuscitation. If the newborn is not breathing and has no pulse after 10 minutes of effective ventilation, or heart rate below 60 beats per minute for more than 20 minutes, you may take the difficult decision to stop the resuscitation. Explain gently to the mother that the newborn unfortunately did not survive. Provide emotional support to the family. Monitoring. The newborn that has undergone resuscitation is at considerable risk and should be admitted, treated, and monitored closely for danger signs. Ensure constant direct skin-to-skin contact to the mother during the first 24 hours to keep it warm. Every 15 minutes for the first 2 hours, you check color, tone, breathing, heart rate, and that the newborn is warm. If the newborn is resuscitated within a minute, keep the newborn with the mother and establish breastfeeding as soon as possible within an hour. If the resuscitation lasted more than a minute, give supplementary feeding in a cup after breastfeeding to prevent hypoglycemia. See action card on pediatric drugs and fluids. Consider that the newborn could be suffering from neonatal sepsis and therefore might need antibiotics. Referral. If post-resuscitation care is not available at your facility, or if the newborn does not respond to management, give first dose of antibiotics and refer urgently to a facility with advanced care. Before and during referral, it's important to keep the newborn warm. Use either skin-to-skin contact or wrap in a soft, dry cloth and blanket, ensuring that the head is covered. Initiate breastfeeding or provide alternative breast milk feeding. Please note that should a small or preterm newborn require resuscitation, the process is exactly the same as for term newborns. By performing neonatal resuscitation, you'll be able to reduce stillbirth and neonatal mortality.